So I got interested in kidney disease already in medical school because we have literally no treatments for these patients that are so vulnerable. And one of the mysteries in kidney disease is why do these kidney diseases even come back after transplantation, in particularly focal segmental glomerulosclerosis or kidney scarring disease. We always have been wondering what is in the blood of the recipients. Are there any factors? Are there any antibodies? 3.5 years ago, we found that SUPAR is one of the factors that can cause post-transplant kidney disease, which is termed focal segmental glomerulosclerosis. So now that we have identified these antibodies and SUPAR, which was done in our laboratory 3.5 years ago, we can risk stratify these patients better because we can evaluate them for the presence of the antibodies and SUPAR, and we can potentially start now new treatment ideas. For example, removing these antibodies or removing SUPAR or both in combination. And I think that's a real medical breakthrough, and that will offer some new help, hopefully in the not so far future. I think at Rush we embrace research that's grounded in clinical medicine, and the description of kidney disease after transplantation dates back into the 1960s. And now 50 some years later, we really have a good understanding what actually the causes are behind these observations. And once we know the cause now, we can go about new treatments. So I think we really closed in on better treatments for patients. In this study, we particularly focused on focal segmental glomerulosclerosis, which is a relatively specific disease, which has a high rate of recurrence after transplantations. But now that we understand that disease better, we can probably infer that other kidney diseases have also similar pathogenesis, which means that also circulating factors and/or antibodies might be involved in causing other kidney diseases that are even more prevalent, such as diabetic nephropathy, for example. That is obviously a speculation. We have to look in that into greater detail, but we have certainly opened that idea further to study. This is real team science that was performed here. We have teams from UCSF, from Rush, from Europe, in France and other countries. And I think that is the way that science should go forward in many big research questions. This is just a way to be more effective and to derive better treatments.